All right, folks, thanks for your patience. We got everybody in now. We're going to go ahead and get started here in just a minute. I'll have Dave kick us off in just 1 second. So thanks again for your patience. We'll be getting going here in just about a minute.
Good morning. This is David Henry. I'm the communications manager for the city of Amarillo. I want to welcome everyone to this special Zoom news conference. We usually do these on Wednesdays. Today, obviously, we're doing it on Friday. This Zoom news conference is related to the governor's announcement yesterday pertaining to COVID-19 policies and regulations which were announced yesterday. We're going to discuss those very quickly. Let me go ahead and introduce who's on our panel today, and then we will have statements from our panel and take questions from our media members. We're joined today by Amarillo Mayor Ginger Nelson, City of Amarillo Public Health Director Casey Stoughton, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, City Manager Jared Miller, and Anthony Spinell, Director of Environmental Health for the City of Amarillo. At this time, I'll go ahead and turn over to our panel, and we'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, thank you. And good morning, Amarillo. Thanks for joining us to go over the governor's most recent changes to the statewide orders regarding COVID-19. I'm excited as a citizen that we're beginning to loosen up. And I think we want to be able to visit with you about what those requirements changed yesterday and get you the information you need as a parent, as a citizen, as a business owner, so that we can operate and respect the governor's authority, but yet be returning to life as much as we possibly can, keeping each other safe while doing it. So I look forward to hearing what our panel of experts has to say. And Dave, I'll hand it back to you.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
Good morning, Dave. It's good to be here on this Friday morning. Just want to take an opportunity to provide a few details regarding the governor's announcement yesterday. While Amarillo Public Health certainly includes Potter and Randall counties, the Panhandle RAC, or the Amarillo Hospital Region, consists of 25 counties in the Texas Panhandle, including Potter and Randall counties. The hospitalization rate for those, all of the counties in that 25 county region includes patients testing positive for COVID and how this relates to the opening capacity for businesses in the Amarillo community. And that is what will be that's what the governor will use to determine that regional rate, as long as a region, we stay collectively under 15%, then we will stay, then some of the reopening activities that Jared Miller will talk about in just a minute as he describes GA30, then some of those activities will certainly apply to us. But just, I think it's important to note that this reopening, this phase of the reopening, we certainly are more regional than we have been in the past. And so we're looking at a 25 county area that is defined by our RAC regions. So the Regional Advisory Council regions, that we're part of that Panhandle RAC. That's a 25 county area here in the Panhandle of Texas. And so we're certainly in it with our neighbors, as we have been since the beginning, since March, when we had our first COVID positive cases here in the Panhandle. Amarillo Public Health will certainly continue to work closely with the state to provide the most current and accurate information so that we can provide all necessary and prudent steps to stop the spread of COVID here in our community. I also want to take a minute to emphasize that as we're continuing down our reopening phase, especially as we're working together as a Panhandle community, masks and social distancing are still so important. We want to make sure that we are slowing the spread of COVID while we're reopening. And so masks, social distancing, hand washing, staying home when you're sick, all of those things that we've talked about since the very beginning are still so crucial in this time of reopening. Again, just want to take a moment to mention the public health drive-through testing site is still available. If you need that, it's free of charge. You can call 378-6300 if you have signs or symptoms that you think might be COVID, and our staff will be very happy to screen and direct you to the testing site. And that's all I have today, Dave.
Thank you, Casey. Let's now go with Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, thanks for joining us this morning. How are you?
Yes, thank you for having me. Good morning to Amarillo and Potter and Randall County and our whole region. I think the important thing from me is to reiterate that the message has not changed from me or from the health department. Casey has gone over that, how important masking and social distancing is. That is the only way that we can mitigate this pandemic at this time. I also want to point out that the Panhandle is different from the rest of Texas, and we've talked about this before throughout this pandemic. Certainly our city is, and our health district is basically Potter and Randall County and Amarillo, but our referral area for the BSA and Northwest Texas Hospital is broad and relatively sparsely populated, but includes several other states. And those cities are small typically and don't have the expertise to take care of individuals who are severely ill with COVID. So we're gonna try to make sense of these numbers. And we had a good discussion, I think, before this press conference of how to do that. And I think we're gonna have a good plan of trying to make sense of these numbers. But I think that the bottom line is, once again, our message is not gonna change. We've got to continue to wear a mask and practice social distancing so we don't stress our hospitalization any more than we have to. Our numbers since school has opened up, our number of active cases has increased. And I think it's increased by several hundred. And so we're seeing this open up further in the face of seeing more active cases in our community. And as your health authority, to be blunt, that worries me. And so once again, I'm just going to keep repeating myself. So that's all I have to say about that this morning, Dave. Thank you.
Thank you, Dr. Milton. This time it's now go to City Manager Jared Miller. Mr. Miller, how are you this morning?
Doing well, thanks, Dave. All right, so the governor yesterday came out with executive orders GA30 and GA31. GA30 supersedes GA28 that we've been under for almost 3 months. GA30 focuses on expansion. It's a progressive or evolutionary phase of the executive orders, which is consistent with how he's been doing the entire reopening process from the very start. The GA30 allows a number of businesses to operate at 75% occupancy as opposed to the 50% occupancy limit that was included in GA28. This is only for areas that are not in high hospitalization areas. And Casey went into some detail on that, and I'll give you just a little bit more. But the areas that are the businesses that are allowed to move from 50% occupancy to 75% occupancy while they are not in areas of high hospitalization include retail stores, restaurants, office buildings, manufacturers, museums and libraries, gyms and exercise facilities. All those can go to 75%. In our area, that does apply. We are currently at 10.1% per the state's metric on measuring our hospitalization rate. And the limit where you have to go back to 50% is 15%. Now that 15% would have to be exceeded for 7 consecutive days, and then we would move down to a area of high hospitalization, which would reduce our occupancy limits for certain businesses. Areas with high hospitalization means any trauma service area that has had 7 consecutive days with greater than 15%. And we're in a 25 county trauma service area. So that's the metric and benchmark that you have to hit to go to a high hospitalization area. To come out of that designation, you also have to have 7 consecutive days of less than 15% hospitalization rate per the state's metric for measuring hospitalization rate. We're going to be tracking very closely with that. And we're also going to put that on our scorecard and on our dashboard so that people can see where do we stand with regard to the state's measurement metric for that. We'll also have other information on our dashboard because we are a 2-county hospital district. So we're also going to be able to show how are we doing in our very tighter focused 2-county area as opposed to our 25 county area that we're measured on and regulated on per the governor's executive order GA30. That sounds a little bit confusing. We'll work with anybody to explain how that works. Also, the following areas have no occupancy limits, but must operate with at least 6 feet of social distancing. I'm only focusing on the areas that are slightly different in GA30 versus GA28. For the most part, our current executive order GA30 is very similar to GA28. So a number of areas can operate with no occupancy limits, but must have at least 6 feet of social distancing. And that includes cosmetology salons, hair salons, barbershops, nail salons, massage establishments, and other personal care and beauty services. The only other noteworthy thing is that bars are still not allowed to open. However, per the TABC, Texas Alcohol, the TABC's guidance that recently came out, they are allowing bars to temporarily be permitted as restaurants. So if they can move their food sales to more than 51% of their total sales and also go through take additional steps to make sure that they're operating as a restaurant, for example, sanitary measures and things that restaurants have to go through that bars don't, they will be allowed to operate under a temporary license as a restaurant. So we're working to facilitate those changes as well. Now, GA31 is focused on hospitals, and the most noteworthy part of that for us and for our region is that it still requires hospitals to reserve 10% of their space capacity for COVID patients. That's all I have, Dave.
Thank you, Jared. At this time, we're now going to open it up to questions from our media members. You have a question for an individual panel member or the panel as a whole. That's perfectly fine. Let's go ahead and start with Roger Gray of KFDA Channel 7. Roger, how are you this morning?
Doing well, guys. I'm just curious. We all watched the governor's press conference, particularly Dr. Milton. Your thoughts, since we are seeing a bit of an increase here, your thoughts about going to 75% in restaurants?
I want to say it's probably.
Well, as I said previously, I mean, it worries me as a physician, and I think that we're seeing our numbers increase. I just got a text from Michael Lamentier that they have now at BSA 45 admitted today in the hospital. That's up 10 from yesterday. So these kind of numbers worry me, and that's why I'm trying to reiterate that, the bottom line is you've got to wear a mask and practice social distancing.
Okay. Just looking for the red.
The Panhandle Spirits starts now.
Hey, Roger, we're picking up your TV audio, I think there, Roger. Roger, are you still there?
I think he got rid of it.
Okay, thank you. Do you have any other questions?
I think that's it.
All
Thank
right,
you.
Roger, thank you. Let's now go to David Gay of Amarillo Globe News. David, how are you this morning?
I'm good. Good morning, everybody. I guess my only clarification would be with the hospitalization rate for the entire region. So it has to be 7 days over 15% to get for us to go back to the 50% mark. Is that correct?
Correct. 7 consecutive days with our hospitalization rate by the state's metric and formula over 15% will move us into a high hospitalization area categorization. Then to move out of that, we have to have 7 consecutive days by that same metric below 15% to then be able to increase our occupancy re-increase the occupancy at restaurants and other businesses like that.
And do we on just because the hospitalization rate is different now because it's including all the different the top 20 the 25 counties within the this Panhandle Trauma Service Center. What is the the highest that we've reached? Do we have that information? Just compared to what the city is reporting for the hospitalization rate for Potter and Randall counties.
No, we currently don't. It's a metric that I believe it's a fairly new metric, and so they'll start reporting it. They've started reporting that this week, so we'll have data moving forward.
Okay, I was just curious if we have hit that 15% before, or if at any point during this whole pandemic.
One thing to remember is that there's a lot of different ways to calculate hospitalization rate, and it really is important to understand what you're trying to articulate when you're saying that. Per the state's metric, what they're wanting to be able to drill down to is hospital capacity. When there's other ways to define hospitalization rate, and it could be the number of COVID cases going to the hospital relative to the total number of COVID positive cases in the community. So both of those are hospitalization rates, but they're reaching different, they're speaking to different requests for information. For example, the one that measures the hospitalization rate of COVID cases versus the total population of COVID cases, that's speaking to how many of our COVID cases go to the hospital. The hospitalization rate that the governor is focused on, and for obvious reasons, is what is our statewide hospital capacity and what is our hospital capacity within the 22 different RAC regions in the state. So that's a key differentiation when we're talking about historical hospitalization rates versus hospitalization rates going forward. We have at Ready Recall and can find on our dashboard right now our historical high hospitalization rate when we're calculating the number of COVID patients that have, or the percentage of COVID patients that have gone to the hospital relative to the total population of COVID patients. But we have not been tracking here our 25 county RAC hospitalization rates by the metric that the governor's using. Hope that's a good explanation.
That's a very good clarification. Thank you so much. And I guess we've heard from Mr. Milton about some of his concerns about this. Does I guess Casey, do you have any concerns about this reopening? Mayor, anybody from the city, do you guys have any concerns about this reopening with the recent increases that have occurred here in the last few weeks?
You know, I think I say very regularly, anytime you gather in groups, there's a risk of spreading illnesses, especially COVID. And so I think that this is another opportunity just to do the very same thing. And so we've got to wear masks. We've got to remember social distancing. We've got to remember, if you're sick, to stay home. And so those things are going to be very, very important, especially in light of our recent increase in cases.
Just add that I know that masks have become a political thing, and I'm not trying to stir any political pots. I'm saying I respect Dr. Milton. I respect Casey. We have seen our numbers change since the governor put in a statewide mask order requiring, and I have to be required too, because I don't always want to wear it. And I seem to get 10 steps away from my vehicle or whatever before I'm like, oh, I got to have a mask. So that there is real data there that says it works, it keeps us safe, it allows us to go back to more normal activities like school, like sporting events. And I am all about having those activities for our children and for our local businesses and our local economy. So I just would agree with Dr. Milton and Casey, and I would ask citizens, not just in Amarillo, but across the entire Panhandle, please comply with wearing your mask, with social distancing. Don't let the fatigue of it get to you. We stay the course. This is something we can do as a community, as a Panhandle-wide community. We are tied together in the governor's eyes and in our hospitals. And Amarillo is okay with that. But what we really need is for everyone to do everything they can in your power to help our numbers stay down. And really wearing a mask, remembering to wash your hands more often than you might otherwise, and social distancing, and stay home. And that's hard for people who own their own business. For me, if I'm not at work, then my business is not producing income. But we have to stay home if we have symptoms. So those are my thoughts about it. Concerned, yes, but confident that if we'll follow those guidelines, we can continue abiding by the governor's orders, but yet opening as much as we possibly can.
And I'd say for me, it's not so much a concern as it highlights the importance of complying with GA29, the face covering rule, because there's a direct correlation between distancing and face coverings and our percentage of positive cases or hospitalization rate. So the more we can adhere to the face covering requirements that the governor's put out, the more we're going to be able to accelerate our economic recovery, and the more our businesses are going to be able to have more customers in their restaurants, more employees in their manufacturing facilities, and all of the other different things that are affected by GA30 that are allowed to increase their occupancy. The better we can do on this as well is very likely going to accelerate the point at which we can have more attendees at professional sporting events, at amusement parks, at zoos, at rodeos, and equestrian events. So all those things from GA28 that are still at 50%, the more we can show positive results statewide, certainly area-wide, but statewide, the quicker we're going to be able to move into a phase of serious economic recovery. It's very important to us, not just individually, but as a community and as a state. So it definitely highlights the need of adhering to GA29 and the face covering requirements.
All right, fantastic. I appreciate your thoughts. That's all I got, Dave. Have a good weekend, y'all.
Thank you, David. This time, let's now go to, if I'm not mistaken, we have, is it Aaron Langston of KMR Channel 4? How are you this morning? Aaron, are you there? We will come back to Aaron in just a second. We do have another media member here, if I'm not mistaken, Taylor Mitchell, KFDA